Thank you, Ryan. Hello, I'm Akshaya. I'm currently in my second year of medicine at the University of Leeds, and I was going to talk to you guys about A levels and predicted grades. So, most medical schools do sort of want triple A or A star AA. That's kind of the most common. And I know Cambridge do want A star A if any of you are applying to Oxbridge, but roundabout mostly aim for triple A or A star AA. And what I would say is that obviously when you're applying for medicine, you do have a lot of things to think about, like a work experience and potentially volunteering and other things. But do try not to forget about your A levels. They are really important, especially through year 12 and year 13. So do kind of keep coming back to it alongside everything else you're doing. Also, with EPQ, I find very helpful. I did my EPQ in year 12. So my school kind of did it in year 12. So we had a bit more time in year 13 to do everything else. And I did find it really helpful, especially within medical school now, because a lot of medicine courses are very research based. There's a lot of research modules. You might have a module just based on research. And my EPQ really did help with things like referencing and writing dissertations. And those are sort of skills that the university does help you with, but it is very helpful to kind of have prior knowledge about it. So I would really recommend doing the EPQ as well. And also within to talk about grades as well, some unis do give you a lower offer if you have an A or an A star in your EPQ, and they're on the slides as well if you can read them. But that's also kind of helpful when you're doing and revising year 13 when you have a lot going on. It's kind of nice to just know that you do have a lower offer and it can relax you a bit. And then in terms of revision for your A levels and for your year 12 exams to get your predicted grades, I do have a few tips that did kind of help me. I'd say my biggest tip would honestly be reading the mark schemes and learning what they want from you with questions, because obviously you're all smart, like you know the knowledge, I know you know the content, but you could be the smartest person but not know the exam technique and they won't give you the marks. So I'd say it's really, really important to read past papers and read the mark schemes, because there'll be key words that, especially with biology and chemistry, they're very, very picky. If you don't say a particular word, they won't give you the mark. Even if you write the whole definition of the word, if you don't have that word, they will not give you the mark. So I'd say that's my biggest tip. Like, please do look at the mark schemes and do as many past papers as you can. And I know a lot of now A levels have kind of gone into the new specification, but with chemistry, I did all the old specification papers as well because they're very similar and they do kind of carry through similar questions as well. So obviously aim to do all the new specification papers, but if you have time, do go back and do the old spec ones as well, because they are helpful and they will have kind of the exam technique you need. But yeah, those are my main tips throughout A levels and through medical school application. And I hope that was helpful.
Now we're going to move on to work experience, and we're going to spend a bit of time on this because I think it's quite important, particularly at this stage, to one, know what we need to do, what you need to do, what kind of experience you need, but how to make the most out of that. So I'm going to start off by talking through the when, what, why, and how. So when should you do work experience? ASAP. So, like I said on the journey slides, it's quite important that you get as much work experience as possible from now up until at least getting it done by August 2025. That's going to be quite important. And like I said, it's evidence. So what can you do? So everyone thinks of, the usual hospital placements. But think outside the box a bit more. So you've got places like the hospice, you've got GP practices, you've got pharmacies, you've also got care homes. Now they're the main ones that people tend to, but you've also got things like charity shops and nurseries where you can actually get some valuable experience and skills of working with different people, working on communication skills, for example, that you can apply to how you've developed certain attributes that a doctor has. And finally, at the bottom there, I've put virtual And I don't know if anyone has seen this so far, but if you're struggling to get ideas for experience or you wanted to beef up your work experience knowledge a little bit more, there are some virtual work experience available, particularly the University of Brighton Medical School offer that. So if you wanted to go over to their page and have a look, that might be quite beneficial for you, just to get more of an idea. But that's not a replacement for these others. But most medical schools appreciate that it's hard to get into hospitals a lot of the time and get that experience. If you're struggling with that, there are other things you can try. It's all about getting the experience that you can apply to, one, being a doctor or a healthcare professional within the NHS, and two, trying to get an understanding of the NHS as well, which I've kind of put here. So why are we doing this work experience? So you want an understanding of healthcare in general. What does it entail? An understanding of the NHS. So not necessarily knowing all the intricacies of it, but understanding how does it work? Who makes up the NHS? What are all the components of the NHS? So that would be good to get that understanding from these different experiences. Understanding the doctor role. If you're applying for any job, you need to understand what you're applying for. And with different experiences, you need to be able to evidence that you understand this. So all of your work experience will be this evidence that the medical schools are looking for. And finally, I put on here, is it right for you? Now, I've known people through my medical school experience who perhaps have got into it without getting lots of work experience, and it's not quite being the right job for them, and they end up either dropping out or getting to the end and doing a different job entirely with that degree. So it's important to get that experience to make sure it is the right job for you, because it's quite a big commitment. And that's probably an understatement, me saying that. It's a massive commitment to at least 5 years of study, and then for the rest of your life after that. So you have to know that this is something you're going to enjoy, or at least be able to get some satisfaction from throughout your career. So how do you go about getting some experience? So firstly, you can observe. So whether you're in a hospital, any of these places, you can observe within kind of how the healthcare professionals, the multidisciplinary team work within healthcare. You can volunteer, and you can either do that in hospitals or other places. So, for example, I don't know if things have changed now, but I used to be a mealtime assistant on an elderly patient ward when I was in Reading, and we used to go around giving patients their breakfast and having a chat with them. But that was my volunteering role. But I actually got quite a lot of experience about how everything worked from that. I worked on my communication skills, understood how the hospital worked. So that was quite valuable. So volunteering roles can be very beneficial as well. I also volunteered in a GP practice, doing just admin, working a bit in reception, occasionally observing some of the doctors. So if it's always worth writing to GP practices and seeing what they can offer. How do you go about it? Well, you ask, like I said, send emails, send letters, go to places and ask, call them up. There's loads of ways you can get in touch with people, and you'll find that a lot of the time, people will be happy to have you. And finally, there's certain things, particularly hospital placements, which you can apply for. So so if they do offer those schemes, then I'd sooner rather than later, before they get really booked up, I'd recommend looking into that. So next, what do the medical schools want to see? So a few things here. So like I said before, the reason we're doing work experience is so you have experience of care, supporting or helping to show you understand the realities of working in a caring profession. The fact that it's not just, oh yeah, doctor's great, you get to know all this knowledge, you get to help people, but understanding that there are downsides as well is quite a challenging job, and kind of showing that you know that as well. So it's also about your opportunity to perhaps show some of the attributes and skills that are essential to becoming a doctor. You don't necessarily have to be perfect at everything, but showing that you have some of those skills, although in a raw format, that show you're the kind of person that would be good medical student to work on those skills and work up to becoming to a level of a good doctor. And also, like I said, it's the evidence of how you've shown these skills as well. Also, it's a good opportunity to get a realistic understanding of medicine. So physical demands, the emotional demands, the organizational side of things, particularly in A&E, for example, waiting times, loads of things you can pick up from this that you can learn about it and talk about within a medical career. And finally, probably the most important is I've written here reflection, reflection, reflection. And I've written this 3 times because I would have written it 30 times if I could, but it'll take up too much space. Reflection is important, and you may not have really come across reflection before. You may know what it is, you might not. Essentially, reflection is where you take a step back, you look at the whole scenario that you've just been in, and you appreciate all the intricacies of what went on. So, for example, if you've particularly done something on your experience, you take a step back and say, oh, did I do a good job? Yes, I had good communication there. Or, I reflect, okay, I didn't do very well there because although I had the good communication, I made the wrong decision, or I should have checked with someone, for example. But it's when you reflect back, you acknowledge the good and bad points, is when you can then show, okay, this is what I'll do next time. And actually, this is a big thing that medical schools want to see. They want to show that you've learned from these experiences and they want to know what you've taken from it. A lot of the time, we see students who come with us with whether it be personal statements or we see them in the mock interviews. And they say, yes, I shadowed a surgeon and I saw this surgery. And then they'll leave it there. But they won't they won't reflect on what exactly they saw and what it means. How did it affect the patient? What toll did it take on the surgeons? How did the rest of the team do? What do you think about the interaction? Do you think it could have been better? Do you think it was a very good whole interaction, for example? You can apply this to any of the experiences. But you can see already, I hope, from me talking about the reflection side of things, that it offers so much more and shows off the fact you've really thought about a career in medicine by reflecting on not only your own skills, but also observing things that have happened as an observer as well. Now, one way to reflect on this that we usually recommend within your work experience is to write down everything that you've been doing and actively think about what you thought, was it good, bad, asking questions, things like that. Another side of it, which I think Dr. Arnold will mention a little bit as well, related to the UCAT, is an element called a situational judgment. Now, that's essentially it's part of the UCAT as a test, but it's also important for us to think about in our practice, which is doing the right thing in the right moments. And there'll be challenging times, whether you're on experience or, in your own life, where there's multiple options that you can take and some are better than others. And it's about making that judgment in those situations, hence the name situational judgment, to kind of make the best out of either a challenging or a good situation. And it's important to think about this when you're on your experience. And sometimes there's a few practice questions that you can do. And you can think about, okay, what would I do now in that situation? And then during your work experience, you could say, okay, how has my thinking changed since would I do something different now that I've seen that in person? But I won't dwell on that too much now. But just if you can take anything away from the work experience side of things that I've talked about, is 1, get some work experience in whatever form, and 2, reflect on that experience. That's the 2 things I want you to take away. Myself and Mrs. Carroll, we're going to do a role play, and you might not know this in medical school training and as doctors training, we do a lot of role plays as practice for scenarios that might happen and do happen in our careers. And so we've got a role play set up, and we're going to think about something that may happen on work experience, but is something that we're going to do from a position of a medical student. Now, take a bit of time just to read the scenario. So Mrs. Cow's going to be the patient, Mrs. Annie Smith, and I'm going to be a first year medical student. I'll be Ryan, not Dr. Ryan. And then we're going to go through, and then we're going to talk about reflection on it. So I'll give you just a moment to read through that. Mrs. Carroll, are you ready?
Ready.
Okay, perfect. So hello there. I'm Ryan. I'm one of the medical students. One of the nurses said you wanted someone to speak with.
Yeah, well, basically, I'd just like to tell you my bags are packed and I'm off. I know it's Sunday evening, it's late, but I just need to go. I've
Oh,
organised a lift and I'll be all right, thanks. So
oh,
it's just to
okay.
say I'm off. Is that all right?
Um, what made you come to that decision, Mrs. Smith?
Well, that's a good question. You know, I mean, I definitely do want to go, so I am, ready to go. But since you ask, I've just, I, I just really, really miss my cat. My cat's really old, and I've had her a long time. And I miss my home, and I've been here long enough, I feel. But plus, you just don't get any rest. I'm not rested at all, and
Mm,
yeah, I have got this infection, but I think I'll be all right. I do feel a bit low mood, to be honest, but I really would like to go. I think home is the best place for me.
okay. I'm really sorry to hear that
Mm,
you're missing the cat and being at home and you're not sleeping
yeah,
well.
yeah, I
Um,
really do.
how
I'm
how are you
sorry.
feeling? How are you feeling at the moment?
Well, I have been better. I've had an operation, as you know, 5 days ago, got an infection, taking antibiotics, but um, I really do want to go, but I'm not, I have felt better. Um, but they've said to me, "Oh, you got an infection," but I'm just thinking, well, is that right? What else is going on? So I think I need to kind of go home and just bury my head a bit, recover, and I'll come back if you need me to, but I'll probably be all right.
Oh, okay. So you said you're feeling better, and
Mm,
do you feel like the antibiotics have helped with your infection?
difficult to say. Difficult to say. Possibly
Okay.
in some ways, maybe, but then I've got some side effects, those usual symptoms. So on one hand, better, on the other hand, not. Yeah.
Okay. How
Mm.
are you getting home?
I've got a lift organised. A relative's picking me up. In fact, they're in the car park waiting for me. So I really do need to go.
Oh,
If you can
okay.
kind of give me some, I don't know, do I need any tablets? I don't know. You would know.
Have you got your tablets at the moment in your bags or?
Well, I've got a few, and maybe someone can pop by tomorrow and pick some more up for me.
Okay. Okay, I'm
Yeah.
sure that's not a problem. I completely understand
Thank
why
you.
you'd want to go home.
Thank you. Yeah.
Um, I'll I'll
Yeah.
I'll let the team know.
Would you? And I'm going to go now then. Okay, it's time. And my
Okay.
lift is waiting for me. Thank
Okay.
you.
I hope you
Thank
feel
you.
better.
Thank you. That's really great.
So, the first of all, I would ask Ryan, what do you think about the conversation? How did it go?
I thought it was a good conversation. I think it's a pleasant conversation. I think I tried to understand and show empathy for what Carol was feeling at the time and understand why she wanted to go home. And I kind of checked how she was feeling as well.
Yeah. Is there anything else do you think you could have done any different?
So, so from the medical student point of view, I think on reflection, from standing back and thinking about it, perhaps I should have checked with my senior colleagues before letting the patient go home. The fact that she didn't have many tablets with her, and although she said she'd come to get someone to come back and get them, as a medical student, I didn't know whether that would be the case. I assumed it would be okay, but I didn't check.
Yeah, that's correct, because one of the biggest thing is knowing your limitations, whatever stages you are, irrespective of medical student and resident doctors. Previously, they called junior doctors, and then seniors, anyone actually. So in terms of making a decisions, we need to know our limitations and competencies and skills. So even though it sounds like a softy discussion to support Mrs. Smith, and then making to understand, okay, she misses her home and cat and sending her home. The most important thing is we need to check with the seniors and knowing the limitations. So as a part of the, let's say you are not a medical student, you are a doctor, then obviously we need to check with MDT, multidisciplinary team, and we should involve her family. So we didn't know what her family situation is. Can she go home? Who's going to look after her? Does she is she carrying someone else in her family? So I think it's a good way to know about the system and then how that works. And I would say in due course, when you are in the similar ward for quite a few weeks, you will know when somebody asks about a discharge. So what are the things you need to look for? And you will know that's I would say it's a good reflection in terms of, yes, we need to know the limitations. Next time we will do it. That's great. Carol, as Mrs. Annie, do you want to add anything from Ryan's consultation?
As Mrs. Annie Smith, I did feel listened to. I felt I had space to talk about how I was feeling, and why I wanted to go home. So I did feel an empathy, and I feel that as a junior doctor, that junior doctor did their best to listen, support, and let me go. As a patient, I wouldn't have known any different to that. I felt slightly vulnerable that I could go because I was a bit scared, really, to go. And maybe I could have been tempted to have stayed with a different conversation, or maybe with a more senior doctor. I could have been persuaded to stay because of my treatment still, and maybe some reassurance that it was only infection, and you'd be going home soon enough.
Thank you. Absolutely. Yeah.
Thank you.
I think for all like year 12 students, you don't get this opportunity in real life situations, getting a feedback from patients and families. So you will get it, but in a different way. You can't get it then and there. So because it's like a role play, and both Ryan as well as Carol did their job great, and then we can feel how the conversation went. So you can feel now the difference between the first time when you watch the consultation and after when Ryan did a feedback and reflection, and also Carol. So this is the way we should, the main reason we portray this is, so if you come across similar conversation in the workplace or work experience where you're doing, you may be thinking something different. So what went well, what can be changed, and then get a different views and reflect across all areas. That's great. Thank you. Thanks, Ryan, and thanks, Carol, for doing this.
Thank you.